Health insurance giant Blue Cross and Blue Shield is now openly backing one of Michigan's Democratic gubernatorial candidates. Now, the race right now is in a primary. There is actually a very contentious primary here in Michigan for who's going to take on whoever the Republicans put up for governor. Now, one of the candidates is Gretchen Whitmer. Now, she is currently running in a primary against several other opponents, one of them being Abdul El-Sayed. Now, Abdul El-Sayed, he's progressive. He actually has a plan to enact single-payer health care for everyone in Michigan. Hell yeah. I'm definitely in favor of that. I'm with that. Now, Whitmer, she is more of your centrist Democrat, right? Your centrist establishment Democrat. She was a former Senate Democratic leader, and she supports fixing the ACA, whatever that means. Now, these two, again, the contrast could not be clear enough. Single payer versus private health insurance. Well, there's a reason that she is for private health insurance, and that's because private health insurance is for her. The Intercept is reporting, thanks to Z. Jelani, that on official Whitmer letterhead, BluesPAC, the company's corporate fundraising vehicle, had blasted out an invitation for a major fundraiser on March 7th. Now, this fundraiser would be for, of course, people who work for Blue Cross Blue Shield. Now, they said in the mailer, Blue Cross Blue Shield of Michigan plays a major role in Michigan's economy and the health of Michigan's citizens. The vibrancy of Michigan's economic climate is driven by public policy put forward by our state's governor, and we believe Gretchen Whitmer will be a great leader for Michigan. Now, the invite is signed by Linda Rossi, Executive Vice President of Strategy, Government, and Public Affairs at Blue Cross Blue Shield, Michigan. Now, the Intercept notes that while the invite is signed by these lobbyists, senior lobbyists with the insurance company, the mailer is actually being paid for by Gretchen Whitmer's campaign. Oh, wait a minute. So you have a campaign that is paying for a mailer, an invitation to a fundraiser held by lobbyists in order to get people who are inside the company to go and donate to Gretchen Whitmer's campaign. Fascinating. So, now, the Intercept also notes that Blue Cross spokeswoman Helen Stojic confirmed to the Intercept that the Whitmer campaign paid for the mailer, but only did so in coordination with BluesPAC. They said the letter was paid for by the Whitmer campaign. BluesPAC gave one-time permission to the campaign to use addresses of BluesPAC members to invite them to the event. The event is hosted by the officers of BluesPAC, not BluesPAC itself. Now, that actually turns out to be an interesting distinction because there are laws in Michigan where these PACs can't actually directly give to a candidate. So they have to have their members, they do a little workaround by appealing to their members and getting them to donate to a candidate of their choice. Now, they said the officers believe that her background in the state legislature has provided her with a good understanding of the state's needs, including concern about the health of Michigan residents. The officers provided an opportunity for BluesPAC members to attend the event. Okay, so I got a couple of thoughts on that line before we go forward. First of all, her background in the state legislature, which is mainly Republican-controlled and pretty right-wing, does not understand the state's needs. What the state needs is Medicare. Now, her teaming up with Blue Cross Blue Shield, a for-profit health insurance company, also tends to send the message that she's not with the American people on Medicare for All, which over 60% of Americans approve of and actually want to see expanded. Medicare is one of the most popular programs in America. And again, over 60% of Americans want to see Medicare expanded to everybody. They support Bernie Sanders' plan. And Bernie Sanders, by the way, won Michigan in the primary. Very exciting. It's actually fairly close because Clinton was expected to be the winner, but of course there are many people in Michigan who are like, hey, I like Bernie Sanders' platform. I like the fact that he's calling for Medicare for all. So that shows that anybody who's touting that has a pretty good chance of actually winning the nomination and winning the election. But anyway, as I said, Blue Cross and Blue Shield, their needs right now are to make more profit off the citizenry by continuing this for-profit system. So again, that's why we're there with Gretchen Whitmer. Oh, we're going to fix the ACA. How are you going to do that? You can't fix what is fundamentally a flawed system. And don't get me wrong, ACA has actually helped a lot of people. It's helped myself. It has helped family members. But at the end of the day, it is incomplete. It is based off a flawed system, a for-profit health insurance model, where we should have a single-payer guarantee of health care. Not access to health care, but guaranteed health care for all citizens. Now, I have one more piece of this. This is, again, another statement from Blue Cross spokeswoman Helen Stojic. She told the Detroit News, quote, while Blues PAC does not formally endorse candidates, it periodically provides its members with an opportunity to directly support candidates for elective office. And this is one of those opportunities. Since in Michigan, of course, there are laws that prevent corporations from directly donating to state candidates. And again, they're trying to tell their employees, hey man, look, you should probably vote for Gretchen Whitmer. Well, now why would health insurance employees want to vote for Gretchen Whitmer? Well, it's because, look, to be honest, their jobs would be on the line. Yes, the insurance industry, there will be job losses in the insurance industry under a single-payer system. So, look, I wouldn't be surprised that some of these people, self-interest, I can understand that. Nobody wants to lose their job. Would go, oh, look at that. Somebody who is for keeping the status quo. But the thing is, unfortunately, things need to change. We need to get rid of, maybe not get rid of health insurance companies, but greatly diminish their role by replacing the system that we have now with a single-payer healthcare system that guarantees coverage for every single American. That is a much better system. And yes, I know, I understand that it will cost jobs. But unfortunately, that is the price of actual progress, and it will actually save people's lives. And the people that will lose their job, they'll end up benefiting as well because they'll no longer be tied to a job. They'll have health insurance. They'll have health care no matter where they go, no matter what job they have. So, now that said, I don't know if I should give you this one more quote here. This is Annie Ellison, communications director for Whitmer's campaign. Now, she offered a short statement to The Intercept saying that, hey, man, look, it's not fair to point out that we're against single payer. I mean, yes, we are because we're more in favor of the current system, but look at what we've done. In fact, she says, the campaign has built support from a large, broad coalition of people who are ready for a governor who will fix the roads, connect Michiganders to good-paying jobs, and put people first. As Senate Democratic leader, Whitmer brokered the deal with a Republican governor to expand health care to 680,000 people through the Medicaid expansion because she'll work with everyone who wants to solve problems and take on anyone who stands in our way to increase access to quality, affordable health care for every Michigander. So there's a couple of things in there. For one, I'll work with anybody. I'll work with the Republicans to make sure that you never have single payer. And that's what I get from that. And then, of course, she says, we want to increase access to quality, affordable health insurance or health care for every Michigander. That's the problem. We don't want access to health care. We just want health care. We want to go to the doctor when we're sick and not have to worry about a copay. Okay? We want to make sure that we can get access to medication. Or not access to medication, that we're able to get medication when we need it. I know too many people, myself included, right, that will hold off visits to the doctor because, hey, man, look, it's too expensive. I can't afford that shit. I can't afford to go. I know people who've stretched out their medications because they can't afford it. Even with insurance, the copays are way too high. Now, Gretchen Whitmer, her campaign is fine with the status quo. It's fine with that system. And the reason is because her campaign gets funded by these special interests. She's interested in the status quo and in not having any sort of actual fundamental change, which is what we need in this country. We need to open up Medicare for all. Now, look, the great thing about this upcoming primary in a lot of different places is that we have a lot of progressive options. There are candidates that are running sometimes against each other that also are talking about, hey, let's do Medicare for all. Now, Sayed, he's one of the guys in this race that's pushing for it. That's pushing for Medicare for all, for single payer here in Michigan. And I think that's wonderful to see different politicians that are pushing for this. But you're also going to see politicians from the other side that are pushing from the right that are going to say, no, our system is fine. We got to keep for-profit healthcare. And as I said, Whitmer is one of those people. Hey, everybody. Thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.